Here we present a case of an endovascular embolization of a perimedullary spinal arteriovenous fistula type 4. The case is a 44-year-old female with no past medical history that suddenly presented with numbness, tingling, and painful burning dysesthesias of the left lower extremity. An MRI demonstrated possibility of a vascular malformation of the spine. Therefore, the patient was taken to the angio suite for spinal angiogram and possible embolization of the fistula. Under conscious sedation, access was obtained through the right femoral artery, and a spinal angiogram was performed until the pedicle that fits the arteriovenous malformation was identified. In this arterial injection, you can clearly identify the very large arteriovenous malformation. Once the guide catheter is stable, a microwire followed by a microcatheter is then navigated into the nidus of the arteriovenous malformation, as you can observe here. Once we obtain access with the microcatheter, another diagnostic angiogram is performed to confirm the arteriovenous malformation and also to perform the WADA test. Once the patient passed the WADA test, we get ready for the MVCA injection. First, we like to have some towels to clear the field, and the microcatheter is then flushed with multiple saline injections to make sure that there is no blood inside of the catheter. Under roadmap and magnification, the NVCA is then slowly injected until it penetrates into the arteriovenous malformation. Different from Onyx, when we inject NVCA, we only have one single shot, and then we have to remove the microcatheter quickly. Post-embolization angiogram demonstrate that the malformation is being completely obliterated with MVCA. Once we do that, we have to make sure that there are no other arterial feeders that might supply the malformation. Therefore, we have to inject all the arterial branches adjacent to the malformation. As you can observe here in these multiple arterial injections, there are no other feeders that supply the malformation, and the procedure is then finished.